Good afternoon, folks. I've got discussion A for you. We're discussing a headline I read. It's decline in U.S. nursing home capacity since COVID-19. Rural areas hit hardest. Okay, that's what we're discussing for A. Please join me in today's discussion A. Here we go. The article highlights a troubling trend since the onset of the COVID-19 pandemic. Nursing home capacity in the United States has steadily declined, with the most severe impact felt in rural communities. Drawing on data from nearly 16,000 skilled nursing facilities, researchers published findings in JAMA Internal Medicine, showing that the pandemic accelerated long-standing vulnerabilities in the elderly care system. National trends and numbers. Overall decline between 2019 and 2024. The number of available licensed nursing home beds fell by about 5% nationwide. This translates to roughly 4,000 fewer beds available each day for patients needing post-acute or long-term care. County level variation. The contraction was uneven. About 25% of U.S. counties experienced declines of 15% or more, while rural counties were Give me 1 second, folks. These are stuck together. These rural counties were disproportionately affected, with some losing 25% or more of their capacity. This decline is not just a statistical dip. It represents thousands of families struggling to find appropriate care for aging relatives. Why rural areas were hit hardest. The article explains that rural communities already faced fragile healthcare infrastructure before COVID-19. The pandemic magnified these weaknesses. The workforce shortage. Recruiting and retaining nurses, aides, and physicians is more difficult in rural areas where wages are lower and professional isolation is greater. Hospital closures. Many rural hospitals have shuttered or reduced services, shrinking the pipeline for patients and resources that sustain nursing homes. Financial strain. Smaller facilities often operate on thin margins. Pandemic-related costs, infection control, PPE, staff overtime pushed many into insolvency. Together, these factors created a perfect storm, leaving rural elders with fewer options for skilled nursing care. Consequences for patients and hospitals. The ripple effects extend far beyond nursing homes themselves. Hospital bottlenecks. With fewer nursing home beds available, hospitals struggle to discharge patients who need rehabilitation or long-term care. This leads to longer inpatient stays, sometimes exceeding 28 days, which strains hospital capacity and raises costs. Geographic displacement. Families in rural areas often must send loved ones to facilities far from home, reducing opportunities for family visits and weakening community-based support networks. Equity concerns. Rural, rural elders already at risk of social isolation face compounded challenges when care is distant or unavailable, deepening disparities in health outcomes. Policy and family implications. The decline in nursing home capacity is not just a healthcare issue, it's a social and policy crisis. The findings suggest several urgent needs: targeted workforce initiatives to attract and retain caregivers in rural areas, financial stabilization programs to help small facilities weather the economic shocks, alternative care models such as home-based services or community health hubs to reduce reliance on institutional beds. For families, the reality is stark. Navigating elder care now requires greater flexibility, planning, and often sacrifice, especially in rural regions where choices are shrinking fastest. Bottom line, the pandemic accelerated a decline in U.S. nursing home capacity that disproportionately harms rural communities. This trend creates bottlenecks in hospital discharge, forces patients to travel further for care. and exacerbates existing inquiries and inequities in healthcare access. Without debate, without deliberate policy interventions, the hardest hit communities risk leaving their most vulnerable residents without adequate end of life or rehabilitative care. Okay, guys, I wanted to also get your take on this situation. So it's an open-ended question and answer session for y'all. So what I'm going to do is I'll leave it up for a few minutes and then we will see what happens. I'll be back on with B shortly. Give me a few minutes for B, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.